And I kind of do it in the same way. I normally will put my hands together in almost kind of like a prayer position.
Personally, I started smoking weed. I wasn't in a good place in my life, I just moved out of my parents. I was alone in my flat. I didn't went that well at school.
We want to get your mood stabilized, and if we're talking kind of from a med perspective here, right? And then from there, we want to give it at least a year and then start adjusting medications.
You have this phase of intense care, which is, depending where, but which is quite done well, I would say. But afterward is like you're basically out in the wild, and it's where people usually relapse. What makes therapy truly work for someone living with both bipolar and addiction? It's a delicate balance between structure, compassion, honesty, and hope. Welcome to Bipolar Talk, the podcast when we turn bipolarity into an opportunity. I'm Clément Bessard, bipolar type 2 and founder of HopeStage. And today I'm joined with Andy Derkershire, licensed clinical social worker and addiction specialist based in Los Angeles. He spent nearly 2 decades helping people find freedom and stability through therapy focused on dual diagnosis, especially those living with bipolarity and addiction. And yeah, I'm just going to let you present yourself, Andy.
Well, thank you for the great introduction. As you said, my name is Andy Dukeshire. I'm based here in Los Angeles, California. I've worked in addiction mental health treatment for almost 20 years, be 18 years in January. Let's see. I've been a certified drug and alcohol counselor for over 10 years as well, and I'm also 19 years sober, clean and sober. And so, yeah, thank you for having me. I appreciate being here and first podcast and a little nervous. And yeah.
It's going to be fun. Yeah, I think the important thing is like to find strength into basically our story. And that's how I feel you help people so much. Can you tell us a little bit like how your addiction made you the therapist you are right now and how you use it to help people in a better way?
Uh, yeah, I've done, my addiction started pretty early on. I think, no matter if it's bipolar, addiction, depression, anxiety, trauma, PTSD, none of us were, 4 or 5 years old going, hey, this is what I want. Something happens to us, we go through some things, our body changes. Yeah, and so I think going through what I did, I was homeless for a period of time in my early 20s from 17 and a half to about 25, in and out of jail. I'd been to prison, pushing a shopping cart, collecting cans. And I went through treatment. I had people that helped me get there. And so, when I was in treatment, I really, when I looked around and I saw my staff, they were smiling and they were happy doing what they were doing. And I was like, it's, that's what I wanted. And so I, I, s- I started working in treatment and went to school, for addiction studies, and then my bachelor's in psychology, and then I kept going and got my master's in social work. So, I've stuck with it and love it, and sometimes it's really hard, but it's also, I've been saying it's one of the hardest things I've ever done, and it's one of the greatest things I've ever done.
Yeah, it's like I was addicted to weed personally, and it really didn't help with my bipolarity. And it's really like when you live through that, it's really interesting how you can connect to people in a way and you can get the trust, to move forward. Can you tell us a little bit, like, what did you learn in your study and how do you help your patient find the click to help them stop their addiction?
I've learned a lot from my studies, but I think specifically with like addiction and bipolar, I learned more from my clients than my studies. My clients have always been my greatest teachers. There's a lot of overlap between people and what we go through. Our feelings are the same. Unfortunately, like when a lot of people come to me in addiction treatment and they have bipolar, and after we assess and diagnose, which I do a very thorough job of, because addiction and bipolar symptoms can overlap. So we want to really make sure to rule that out. And sometimes or a lot of times we haven't had a lot of sobriety to, really rule things out. So it makes it a little bit more difficult. So doing a very thorough assessment is a very good thing. But usually most of the time, and what's kind of scary is a lot of times my clients with bipolar have had treatment episodes before. And in the first session, I ask them, what do you know about bipolar? And they shake their heads and go, I don't know anything. I'm like, well, it gets frustrating because I'm like, well, what's happened in treatment before? Like, why hasn't anyone talked to you about this? Why hasn't, So usually I go over, like just kind of the education portion first, like what is bipolar and kind of going from there.
Yeah, and maybe we can describe a little bit what is bipolar because I feel every definition is different because depending on if you do it on the medical part, on the personal part, the way I explain it is for me is the sickness of the emotion. So, and it's a chemical problem. And basically, you have HOP, which is euphoria, where you're basically on coke for a few months. You don't need to sleep. You're overexciting, overconfident. And then you have the other pole, which is basically depression, where you have a lot of fatigue, lack of energy, and it happened in the phase lasts at least a few weeks to be considered as bipolar. And that's the way I talk about it. But how do you talk about it with your patient? Because I feel you're right. It's really important, at least from what we've seen, to know what you have and to understand it really well.
Yeah, and I kind of do it in the same way. I normally like will put my hands together in almost kind of like a prayer position, and I'll go like, "This is hypomane," or I'll go, "This is mood stability, right? This is normal." I don't know what normal is these days, right? But um, here's hypomania, and then here's mania, and then we go back, and then here's depression, and then I go, here's like the side effects of mania can be, really severe. It could be delusions, hallucinations, hypersexualness, hyper spending, hyper drug use. Um, explain some of the consequences with that, right? And of course, lack of sleep, but and aggression, right? So, we may be getting into arguments with people that we love and know, and friends, or people out on the streets, or going to places, dangerous places, and dealing with dangerous people to get and use substances, and not being so mindful. And it's even scarier these days, whether you have bipolar or not, too, doing that because, fentanyl and everything being laced with fentanyl. And, you can OD very quickly if not careful. And maybe you're not even going out to get fentanyl. But like I said, things are laced with fentanyl. So I kind of start there. And then the other part, I talk about depression, and I talk about how, like you said, we don't want to, lethargy, not necessarily get out of bed, and I think a lot of people don't realize too that with depression, you can also have hallucinations and delusions. But one of the parts that I really focus on too is, and what I think a lot of people don't focus on too, is how much it can really affect our thinking. And even when we look at the DSM, really it talks about how much it can affect our thinking, which we use to diagnose, all these mental health disorders or issues. And so I kind of describe it as like a tunnel, right? It affects our thinking so much. And it's kind of like we're in this tunnel. And on the side of this tunnel, there's these exits, and these are the solutions. And it's really hard for us to think and see these solutions. And hopefully, at the end of this tunnel is a good solution, right? So, and hopefully it's not addiction, it's not suicide. And one of the things I kind of teach, is cognitive mastery to help with that, right? So, cognitive mastery is what I was taught in grad school. It's this idea of checking in with ourselves. What's going on? What's happening with me? What coping strategies do I have? Keeping those coping strategies at the forefront of our mind, right? So if we're depressed or if we're starting to feel manic, we can use them right away, but especially if we're feeling depressed. And also which ones work for us, right? You may like meditation. I may like yoga. You may like exercising. I may like skateboarding, whatever it may be, and using them quickly, right? Because I think we've all been guilty of sitting on our coping strategies, but the quicker we can deploy them, the better off we're going to be. Whether that's reaching out to somebody. Yeah, and I also talk about there's an acronym that is often used like in addiction treatment, and I believe in the rooms of 12-step programs, but it's called HALT, right? Am I hungry, angry, lonely, tired? And so when we can check in with ourselves and kind of identify these things, I mean, it may not be one of those four things, but it can be a good way to check in with ourselves. So, yeah, I think I answered the question.
Yeah, yeah, yeah. It's like that's one of the things which is really important is to at least I can talk a little bit about my addiction. Personally, I started smoking weed when I wasn't in a good place in my life. I just moved out of my parents. I was alone in my flat. I didn't went that well at school. And I think I started smoking weed because I I didn't felt like socially accepted like I used to. And it was kind of a way to get out of reality. And then you start smoking and you smoke more. And then depression happened. And then hypomania happened also. But I didn't know I was bipolar at the time. I didn't know I had hypomania. And it took me years to understand that weed and bipolarity couldn't work together. And when I was diagnosed, I wasn't smoking much, but then I decided to really stop and not touch it anymore because I know that I have a tendency to be really addicted to substance and whatever substance actually. And so it was tough for me to accept that, to accept it that yeah, I cannot just have a joint because the consequence for me are much tougher than other people. I'm curious to know a little bit about this HALT framework and what, like, if you're listening and you're having an addiction problem, um, what what do you want? Like, what is the first thing you should do, and how to get help? Like, what do you tell your client, Andy? Like, because the first step is to actually like want to change, and that's probably the toughest, because if you don't want this change, everybody can tell you it's bad or anything, but you're not going to do it. So what do you want people to listen to?
Question. I think it's kind of sometimes pointing out what life can be, right? Usually when I have a client sitting in front of me, it's, things haven't been going the greatest. Um, and, I think we've all experienced joy, happiness, and it's may have been some time, but kind of pointing that out, especially whether it's addiction or bipolar or depression or anxiety or trauma. We usually have a framework of when life was good. And I think sometimes even just kind of helping them remember that and showing them that it is possible to get back there, right? Like it's going to take some time, some work. Um, you know, like you kind of described, we kind of want to feel normal, feel part of, it kind of sucks to say, hey, this may only just be weed, right? And of course, weed's a lot different from when I was growing up 20, 25 years ago. Much stronger now, like you said, but everyone reacts differently, right? And if you have bipolar and mania and potentially, hallucinations and delusions from it, yeah, it's not a good formula. Um, but I think pointing out to them like, hey, that there is, this is worth it, right? I mean, I could even talk about myself and how much I've accomplished and done, but also, I want them to find out I want them to be able to see that for themselves, right? So,
I think it's also interesting, like, it's what I love to do with the people I see is to give them hope, to also, because I don't have a degree of, I'm not a psychologist. I would say I'm an entrepreneur, so I like to build a system and to find the right people and to put them together, like psychiatrist, psychologist, be helper, and to build a team around the person. But what I like to do is to try to give the person the first push, like there's hope, there's like you can find a way out of your addiction, and if you want it, then we're here to help you. But what would you like to tell us, like, about like having this first moment of like, okay, I'm not a desperate case, I can find my way out. And maybe it's interesting also to share your journey, because I think it's also what I do, and it gives a lot of hope to see, like, so I'm curious to know a bit more about it.
you cut out a little bit. Could you repeat the first part again?
Yeah, yeah. So I was talking about, like, how do you find a way to give hope to people? Because before the person actually go and see a therapist, a psychologist, whatever, and it needs to get this little push, this little hope. And that's what I love to do, on content on podcasts like you're listening to, is to tell you that there is a way. I know it's difficult, maybe you're not in the right moment now, but we've been through that, and we've seen thousands of people been through that. It's like you can have an addiction, it's really tough, and then you find your way, and you find a way to stop it. And can you tell us a bit more, Andy, like, what was the moment you changed, and how did you do it? And I think it's also important to know the story behind.
Uh, yeah, kind of going back, I think you're absolutely right. That initial phone call, whether it's to me as like a therapist or a treatment center or doctor or psychiatrist or a nurse practitioner, right? Um, that's the critical moment. And so and it's like, I definitely want to instill hope there, right? Um, and I think, one, it's just about listening, really, and hearing what's being told to me and actively listening. We live in a fast-paced world, and so active listening's not the greatest. We're not the greatest at it, especially with their therapy being a relatively new thing, right? I mean, I looked up a couple weeks ago, me and my coworker were looking up when lobotomies were last done. It was like 1982 in France. And I was like, I thought it was longer than that, right? So, when we talk about emotion regulation and medications and treatment and, interpersonal effectiveness and, yeah, therapy in general is a relatively new thing. But I want to listen. And, I was taught to, I want to build rapid rapport, right? So that listening, I get to know you, you get to know me. And I think a little bit of laughter goes a long way too, right? If I can make you laugh, and just, yeah, it's going to be good. But also on that initial call too, right? I want to, um I wanna give you some interventions to kinda get the help going right away too, whether it's just like, even if you don't call me back, but, "Hey, at least here's this for you for now until we can meet again," or, whatever the course is. For me, what changed, I think, a lot was actually I stayed in treatment for a very long time after I got out of, prison. My aunt and uncle were there to help me, and I was in treatment actually for 13 months, and that was my second time in treatment. I went on my own accord. I mean, the first time I was court ordered, but even then, I still got a lot from it. But and I was young too at that time. I was 24. And I was ready, and it took a lot of work. I mean, I was a two-time high school dropout, a continuation school high school dropout. I'd been homeless for about 5 years at that point. Um, and I just really was allowed the time to get better. I mean, not everyone gets the luxury of being in a treatment center for 13 months. Um, but, I got my GED while I was there. I learned how to drive while I was there. I started going to community college while I was there. Was able to go to lots of 12-step meetings while I was there. Was able to do lots of groups while I was there. And so I was given this grace really that, at this time to heal. And actually, even when I talk to people about my clients about bipolar, one of the things that I tell them, because a lot of times, at least here, treatment centers, through insurance, that are addiction treatment centers, insurance only wants to pay, usually only does like 30, 45 days in residential, maybe a week or two in detox. They may do residential up to like 60 days, but we want to work quickly, right? To get things in order because, you're going to eventually be going to partial hospitalization program, which is outpatient, then an intensive outpatient program, right? So we're maybe looking at like 4, 6 months of treatment, right? But every psychiatrist that I worked with who have found to be really good, they've always recommended to our clients that have bipolar to, we want to get your mood stabilized, and if we're talking kind of from a med perspective here, right? Um, and then from there, we want to give it at least a year and then start adjusting medications. And kind of in hindsight, I feel like it's almost kind of like when we get sober, get clean and sober, right? It's like we want to allow the brain time to heal. But then, after that year, work with the psychiatrist to figure out medications more. I always tell clients, I love and I hate medications. I love them because if we find one that works, and it could be a game changer, of course, therapy, we want therapy with that as well. But also I hate the fact that it's kind of a trial and error process, right? Kind of like how we talked earlier about how weed affects everyone differently, right? We've done some research. We generally know how this is going to work for a person too, but also people react differently, right? And then depending on our symptoms, you may get some medications that do this and that, and it's, they may, a lot of people in general don't like medications because of that. A lot of my clients don't like to take medications because they don't want to feel flat, you know, um, and we tend to like the feeling of mania too, right? Energetic on top of the world. So I'm like, I almost don't blame you, right? But we don't want that either. We don't want you to feel flat, and I want you to know that you can also feel like that and have emotions at mood stability, right? Even on medications. So I think I said all that clearly, but and didn't miss anything in there. But yeah, it's possible, and that's also where I think, whether it's me and when I went through treatment or whether you went through treatment, right? A lot of communication. I was very fortunate to have a lot of great staff that just took the time to really work with me. I mean, I had to learn how to read, write, do math again to go to college. It had been like 10 years probably since, I've really been in school. Yeah, if not longer. I don't think I ever really went to school growing up. But so yeah, I was very fortunate to kind of have all that time to get better. Sorry, that was a very
Yeah,
long-winded
no,
answer.
no, it's I think it's really important because it's like that's one of the things we don't talk about. It's like the time that it takes.
Quick break. Can you let us a review on Apple Podcasts or the platform of your choice? It really helps us break the stigma around bipolarity. Let's get back to the episode.
And people, because of today's society, we want things to work in like, oh, I will take this pill, I'll do that in 2 days, poo poo poo, it's done. No, and that's the tough things. Like if you have an addiction, if you're bipolar, and I always say the sad story, it takes months. In the best scenario, it will take a few months to just recover, to just like, because the way it works is, at least I won't talk about addiction, I will talk about phases, but it's like when you're, for example, in hypomania, and let's be honest, I used to like it, I'm not gonna lie. It's like, basically, it will take at least a few months for your brain to recover, because you send all the hormones on your brain, the dopamine, serotonin, whatever, and then your brain just need to recover. And even if you do everything right, so let's say you're not taking any drugs, you're doing your sport, you're taking your meds, you're finding the right meds, which is not easy. And even if you do that, you're not going to feel like the good effect and stability for at least a few months. And usually we talk about it like it's called the remission phase. And sometimes it takes 6 months, 1 year. And same thing after depression. And that's the toughest part. And that's the part we need help. And we need to have someone who take us by the hands. And it could be in a medical area. It could be like with a treatment facility. But when you get there and you do the work, and it's going to be tough, but then when you finish that, it's like, life is just so much better, and everything just go back, and it's crazy our brain recovers so well also. I'm always surprised to see people who have been like, oh, I cannot do this, I cannot do that, but after 1 year, after the remission phase, then they get back like most of their capacity. So I think it's important that you did the long answer, and I do the same, because I think it's a subject that it's really like, you need to understand that it's tough, it takes time, but when it's done, it's so beautiful, and I wish you to go through that. Um, how do you help people? Because you have this phase of intense care, which is, depending where, but which is quite done well, I would say. But afterward is like you're basically out in the wild, and it's where people usually relapse. And so, what do you do, and how do you think we can do this phase, this transition better, and how do you help your client do that?
A great question. I feel like I've been kind of talking about this a lot lately. One of the things that we do want to work on is the coping strategies for when they do return to, whether it's home or wherever they're going next to, right? Maybe they're going into like a sober living. Are they going back home to family? What's the family situation like? Are they triggering? Have we done family therapy? Can we even talk to the family and um kind of figure out some things there, right? And actually it's coincidental because one of the things I was going to, I kind of prepped to talk about too is like relationship repair, right? Because, we talk about mood stability and we talk about sobriety, and but also it's like, what have been the things that we've done, um, during our manic episodes or depressive episodes. Have we not called people back? Has it been some time since we called people back? Were we aggressive with family members or friends during a manic episode, or even during, our using episodes? Were we drinking or whatnot? And so, and if we're manic too, like we may not be able to kind of see how our behavior was presenting, right? During these times. And with the sobriety and mood stability and kind of reinforcing that, and we can actually talk about these things and kind of talk about ways to repair relationships, right? Oftentimes in addiction, we've apologized a lots and lots of times, and probably even, in mental health, with mental health issues too. And a lot of times when people come to me, they're at a point, their family's at a point where it's like, I don't want the apologies anymore. I just want to see them better, and we usually, and at that point, they usually want to see it for some time too, right? Because we didn't mean to hurt them. We didn't intend to hurt them, but it's what happened. So, I think helping my clients understand that part, right? Can we do some family therapy to, do the friends even know about mental health, right? There was this author, and one of the things that she wrote about in some of her blog articles, I can't remember her name off the top of my head, but she essentially says that, we die from addiction. It's your job to understand it, right? But not everyone in the world, I'd probably even say majority of the world doesn't understand addiction, let alone mental health. But we probably all have mental health issues, right? Who hasn't gone through some depression or anxiety? um, where was I going with all this? But yeah, like, do we need to teach the family about it, right? Help my clients identify what triggers are going to be there, whether it's for mental health or addiction. Is the family a trigger? Is it someone in our life? Is it the environment? Is it the places where we used to use? Maybe even it's a fun event that we go to, right? Like fishing, right? It's like, well, I didn't, we associate that with our using, and then all of a sudden we're back home, we're fishing. It's like, oh, yeah, beer or a joint would probably be really good with this, right? And I usually kind of teach too about, one of the things, I worked at a very short term treatment center, and it was only 6 weeks, 2 months long. We only did detox, residential, PHP, and people either went home after that or we referred out to an intensive outpatient program. But off the one, some of the clients that went home and they came back because they relapsed. And I was like, what happened? And they would say, the same, there was these common themes. And so the first thing was they'd say home was a lot harder than expected, right? So it's like, yeah, that's the importance of the family therapy, knowing the triggers in the environment, all that stuff. And then the other part is they say that they didn't have a plan, or they didn't follow the plan. My apologies. So one, I explained that, yeah, it's going to be hard, right? Expect it to be hard. It's not going to be easy. What can we do to, prepare you for that? And the other part I say too is have a plan and follow it. And I always say the plan can be reevaluated anytime, right? The plan can be switched around. And I think a good indicator of that is how comfortable or uncomfortable we're feeling, right? If we're feeling uncomfortable, maybe we increase therapy or see your psychiatrist or do more meditation or more yoga. Um, if we're feeling comfortable, okay, maybe I do therapy every other week and then maybe once a month and then maybe once every 3 months, or, so yeah, we want to, essentially prepare them. I also usually teach, depending if they're going back to, and this is like old school, this is what I was taught when I first started doing addiction studies, is like the family system's kind of like a mobile, that hangs above a baby's bed, right? And so the family system is used to, working as like a mobile does it. One part moves up, one part moves down. And so, we may have gone to therapy, we may have got, changed, right? But then we go back into this environment, and this mobile is trying, recreate homeostasis. So, we have to be able to kind of respond to it in a different way because it can kind of, bring us back in. I'm not sure, trying to think of a better way to say that, right? But, it's going to try to recreate, find homeostasis to operate like it used to, right? This person's used to responding to us in a certain way. We're used to responding to them in a certain way, but now we've changed. And so it's like, what can we do to, fix all that, create a new homeostasis? Yeah. So,
Yeah, and something we haven't talked enough, I guess, is of course you want to apologize to other people, but it's also about apologizing to yourself. And that's one of the toughest part is to really say to yourself, like, I remember I was ashamed of what I did. I was ashamed of the things that I didn't do also in depression phase which I did do in manic phase. And to really tell yourself like, okay, it wasn't the right decision, but I forgive myself. And because I forgive myself, I'm not going to put stigma on myself anymore. And I will do better next time, but I'm not thinking all the time about the past, about what I did wrong and having regret, because it's tough if you're listening. And I know I've been there, but really just take a deep breath and forgive yourself, I guess. That's one of the toughest part. But you're also explaining a little bit like, and I feel it's really important, like how to get back into your family and your community. And and it's why we need help. And the fact that we can think that it's gonna go back to normal. No, it's never gonna be back to normal. It's gonna be a new life. It's gonna be a new challenge. And it's why we need a team around us. And some people cannot afford like a one-on-one team, but everybody can afford a community online. Almost everybody can like have a talking group, can afford a talking group, and really like building this. So whenever the plan seems difficult, you have someone to talk about it with, to reestablishing the plan. It's a great conversation, but I'm trying to stay back into the time. I have one last question, Andy. Like, if you had a magic wand, what would you change in mental health?
oh, I've been listening to all your podcasts, and there's been some really great answers. And I feel like Dr. Arjun stole my answer, by the way, but because he talked about psychosocial stressors and, like the mental health issues that go with like expensive rent and things like that. But um, I think I would take and kind of like just you described and kind of what you're all about, right? I would probably bring all the mental health information and treatment and all the good stuff that we know from all around the world, right? And kind of bring it to, a very easy way to access it. But I would also would want it to be like what is going to create the success, right? Too. So not only do we have like the best treatment and we have all this knowledge from all around the world, in one place and make it easy for people to access, but also let's, what can we do to keep the success going on for years to come, right? Is it wraparound programs? Is it having a counselor check in on me once a week or once a month or have affordable housing. I think it's almost like I had a professor in grad school, and, when we talked about homelessness, he'd be like, that's what we call a wicked problem, right? Because it's usually, we need to work on addiction. We need to work on mental health. We need to work on physical health issues, career, employment, right? Training for such jobs. And like we kind of talked about, all that takes time. So, having really just all the good treatments from around the world, but also creating like a program that would allow that time to, deal with such wicked problems, and get to a point where we can, have a good life. I hope
Yeah,
that made sense.
yeah, yeah. I don't know, and it's why I love this question. Is like every answer is personal, and there is no like one good answer. But no, I like our conversation. Thanks a lot, Andy. Is like I think it's really important, and it's what I loved is like we can share our story, and if you're listening, there's hope, and that's why we're here. You can comment if you want to contact Andy or myself, and we're happy to help you on your path to recovery. And I know it's difficult. I know there's some time you cannot know the solution, but you will find a way. And we are the story is a good story of letting you know that it's possible. And I just wanted to let you with that. And I know, and it's gonna be tough. It's gonna be long. But we'll be here, or someone else will be here to take you by the hand and to help you in this journey. And just try to think about maybe like 5 years from now, 20 years from now, how much happier you will be. Because that's how it helped me every day, is to really have this long term of like the happier life I will have, and the small decision I make today to get to this happier life. So thanks a lot for listening, and see you soon. And
Thank
then I
you for
was
having me. I appreciate it. First podcast. But like you said, we're here to help. There is help out there. I think oftentimes we feel alone. Um, but the reality is, you're not the first person, and unfortunately not the last person to go through this, but that also means that there's help. And kind of like what you're talking about earlier, we can be really hard on ourselves, and learning to forgive ourselves, and even talk to ourselves like a friend, right? If a friend came to us with the same problem, we'd be so much nicer to them, and so much, we'd essentially, what I'm getting at, so much more grace, right? But when it comes to ourselves, we can be very critical of ourselves, and I did this again. But so we want to talk to ourselves like a friend as well.
To learn more about bipolarity, go to our website, hopestage.com, HOPESTAGE.com. See you soon.